wrong dose, the wrong patient, either too much or at the wrong time. So South Dakota did better because it had access to hydroxychloroquine. Thank you so much.
Okay, so if someone we love does get sick with COVID, and you said that the hydrochlor, whatever how you say it, is restricted, how do we get access to that?
That's the number one question we're all asked every day. I want you to know that you're not alone. I've had many congressmen ask me, how can I get it? So if the congressman can't get it, it's tough luck for the average American Joe getting it. It's very difficult. You have to overcome a few hurdles. Your doctor has to have read the science with a critical eye and have eliminated the junk science. Many studies have been retracted, as you know. And number two, the pharmacist has to not restrict it. Many states have empowered their pharmacists to not honor physician prescription. That's never happened before. That interference with the doctor-patient relationship, where the patient talks to the doctor honestly and the doctor answers the patient honestly, has been violated. So you have a very difficult time as the average American. Some of the information we'll share later this afternoon is to show the mortality rates in countries where it's not restricted and the mortality rates where it is restricted. So I have friends all over the world now because of this. And in Indonesia, you can just buy it over the counter. It's in the vitamin section. And I'm here to tell the American people that you could buy it over the counter in Iran because the leaders in Iran, the mullahs in Iran, think that they should have more freedom than Americans. I have a problem with that. My colleagues have problems with that. We don't like to watch patients die.
So, Dr. Cole, if people have problems, they should be picking up the phone, and they should be calling their state and their federal representatives and senators and say, we are the American people, and we demand
Let me say one thing.
So you guys, we need the public to be
Right. Thank you, Julie. That is exactly right. If you hear when you hear this, if you're concerned and wondering why you may not be able to get access to it, we need you to make 4 calls. Call your governor, call both of your senators, and call your congressman. And tell them that you want to know why you're not able to get access to a drug that doctors are telling you will help end this and help us reduce the number of hospitalizations and reduce the number of deaths. Urge them to read Dr. Harvey Rish's study from Yale. He's a Yale professor of epidemiology, and from there you'll find other studies.
Yes.
I wanted to ask, how do people trust the data that they're looking at every day? The numbers are so variable, whether you go to Johns Hopkins, CDC, which divides COVID deaths in different categories, whether it's related to pneumonia, other things. So how do we get the right information to make decisions?
So the only number that I think is worth paying any attention to, and even that number is not so helpful, but is mortality, because that's a hard and fast number. So the case number is almost irrelevant. And that's because there's a lot of inaccuracies with the testing. And also, even if the test is accurate, most people are asymptomatic or mildly symptomatic. So it's not that important to know. So the case number, which you see rising all the time in the news, is basically irrelevant. And if you had told us a few months ago that that was the number that the media was going to go crazy over, we all would have just laughed at that. I mean, that's essentially herd immunity. There's lots of people out there who have tested positive without symptoms or with very mild symptoms. So the only number that's worth paying attention to is mortality. When you look at the mortality, this is a disease that unfortunately kills our most frail members of society. People with multiple comorbid conditions, specifically diabetes, obesity is a big one. We don't talk about that, but it is. It's a fact. Coronary artery disease, severe coronary artery disease, people like that. And also, if you're older, it's a risk factor. But the biggest risk factor is if you have comorbid conditions. If you're young and healthy, you're going to recover. If you're under 60 with no comorbid conditions, it's less deadly than influenza. This seems to come as great news to Americans because this is not what you're being told. I would say the answer is it's very difficult to get accurate numbers.
If you, this is Matt Purdy of Breitbart News, if you had a message to Dr. Anthony Fauci, what would you say to him?
Listen to the doctors. Listen to the frontline doctors. Have a meeting with the frontline doctors. And maybe I need to say that into the microphone. My message to Dr. Anthony Fauci is to have a meeting with these frontline doctors who are seeing real patients. They're touching human skin. They're looking people in the eye. They're diagnosing them, and they're helping them beat the virus. They're the ones who are talking to the patients. Have meetings with them and do it every single day and find out what they are learning about the virus firsthand. And it's important to understand we have doctors here who are not emergency room doctors. They're preventing patients from even hitting the emergency room. So if they're only listening to emergency room or ICU at the very tragic end of a person's life, they're not getting the full story. They need to come back and hear the earlier portion, and they also need to understand what the lockdowns and the fears are doing to patients around this country, because there are a lot of unintended consequences which the doctors can speak about.
Let me say something. My message to Dr. Anthony Fauci is, when is the last time you put a stethoscope on a patient? That when you start seeing patients, like we see on a daily basis, you will understand the frustration that we feel. And you need to start feeling for American people like we, the frontline doctors, feel. And you need to start realizing that they are listening to you. And if they are going to listen to you, you got to give them a message of hope. You got to give them a message that goes with what you already know, that hydroxychloroquine works.
Okay, I actually have a question for Dr. Warrior.
Dr. Emmanuel.
Dr. Emmanuel, you mentioned before some remarkable results that you've had treating your own patients. You said, I believe, over 300 patients that you take care of.
Yes, sir.
Have you been able to publish your findings and the results from those patients?
We're working on publishing it right now. We're working on that. But this is what I'll say. People like doctors tell me all the time, publish the data. And my question is, and that will make you see patients? There's enough data around the world. Yes, my data will come out. When that comes out, that's great. But right now, people are dying. So my data is not important for you to see patients. I'm saying that to my colleagues out there that talk about data.
And if I can ask one more question.
May I just interject? There is a lot of
data out there
on this. Not every clinician needs to publish their data to be taken seriously. The media has not covered it. There is a ton. I've got a compendium on AmericasFrontlineDoctors.com.
Yep.
There is a compendium of all the studies that work with hydroxychloroquine. The mortality rate was published in Detroit less than a month. It was July 4th weekend. They published it. Mortality by half in the critically ill patients. The patients who get it early. It's been estimated that 1/2 to 3/4 of those patients wouldn't be dead. We're talking 70,000 to 70 to 100,000 patients would still be alive if we had followed this policy. There's plenty of published data. I'm sorry
even
that
with
it's
Dr.
not
Rich.
out there.
Dr. Rich published data recently, so there's a lot of data out there. They don't need mine to make those decisions.
If I can ask one more question.
Yeah.
There was a little girl who just a few days ago was 9 years old, otherwise healthy, and it was reported that she died of COVID-19. So I was curious, as from your perspective, do you feel that this little girl possibly died from some other condition that was wrongly attributed to COVID-19, or is there some other reason why she would have died from COVID-19?
I will not be able to say that till I look at the little girl's literature, the little girl's history and whatever happened. I know I've taken care of a lot of family members, and I see a lot of children, and they usually get mild symptoms, but I cannot talk about a case that I've not looked at.
Let me show you. What was the age of the child again?
She was 9 years old.
Okay. So listen, there are children who are dying of this infection. And the reality is that when they do die, they seem to have comorbidities. Really, you have to kind of look at each individual case uniquely. There have been a little over 30 patients in the entire country in the age category of 15 and below who have died of COVID. Frequently, they do have comorbidities like heart disease, they have asthma, they have other pulmonary issues. So I don't know. We don't know the answer to this 9-year-old girl, tragically. She passed and she's no longer with us. But there's probably, if you dig into it, there's probably a story behind it.
Dr. Hamilton, have you seen any patients who are having adverse side effects because schools have been closed, with depression or suicide?
I mean, I think that it is common knowledge that with the schools not being open, when you think about what your experience in junior high and high school, what do you think about? You think about parties and you think about football games, socializing. Those are the things we think about. Those are all being shut down, folks. Nobody's having fun anymore. And I will tell you that these are critical years of life to be out mixing with other kids, other people, and that has been shut down. So yes, there are lots of comorbidities that go along with shutting down. We're talking about anxiety, we're talking about depression, loneliness, abuse is happening, and kids who have particular children who have special needs kids are not doing well either. So there is a long list of complications that occur when you quarantine and lock down people.
So an extension to what you were just talking about, we hear all these studies and all this polling that moms are afraid to go back to work because of letting their children go to school. They shouldn't go to school because they're going to be exposed. And if the moms go back to school, then the elderly grandparents are
right. Well, this is the big. Sure. Yeah, this is a big issue because people are afraid, not that their children are going to get particularly ill, because I think they're learning the truth that this infection is being tolerated well by children, but certainly they look at their environment, their particular unique family, and I think in some situations that may be an appropriate fear. However, I do think that as a general comment, a general rule through the country, kids can go back to school. Maybe a few kids here and there, their living situation, who they're being cared for, that can be a potential problem. But again, for younger children in particular, they're not the ones passing on the disease to the adults.
I'll talk about it. I mean, maybe Dr. Emanuel can speak to that, or somebody else.
Well, hydroxychloroquine, yeah. I mean,
in terms of as a prophylaxis.
that can be done. Yes, that can be used.
Yeah, really quickly.
Okay. We're talking about we can't go to open our businesses, we can't go to school, and parents are scared to get treated. And I personally have put over 100 people on hydroxychloroquine prophylaxis, doctors, teachers, people, healthcare workers, my staff, me. I see over 15 to 20, sometimes 20, 15, 10 patients a day. I use a surgical mask. I've not been infected. Nobody I know has been infected that's around me. So this is the answer to this question. You want to open schools? Everybody get on hydroxychloroquine. That is the prevention for COVID. One tablet every other week is good enough. And that is what we need to get across to the American people. There is prevention and there is cure. We don't have to lock down schools. We don't have to lock down our businesses. There's prevention and there is cure. So instead of talking about masks, instead of talking about lockdowns, instead of talking about all these things, put our teachers on hydroxychloroquine. Put those that are high risk on hydroxychloroquine. Those that want it. If you want to catch COVID, that's cool. But you should be given the right to take it and be prevented. So that's the message. All this stuff that we're putting together is not necessary because hydroxychloroquine has a prevention. Hydroxychloroquine is a prevention for COVID.
Earlier I heard you say that
hydroxychloroquine.
Yeah, that drug was the cure. But you also said measured with zinc and other things.
Yes.
And you guys also said that previous doctors have used it, but they've used it in the wrong dosage. So I keep hearing the drug, but then what is the right dosage? What is the right what is the right mixture?
Yeah, that you're going to discuss with your doctor. But let me let Dr. also take that.
Yeah, that's a great question because the fear of this drug has driven the whole political situation has driven the fear towards this drug. So let's address that. This drug is super safe. It's safer than aspirin, Motrin, Tylenol. It's super safe, all right? So what the problem is in a lot of those studies, they did very, very high doses, massive doses. All through the country, they did the REMAP study, the Solidarity trial, that was the World Health Organization trial, and also the recovery trial. They used 2,400 milligrams in the first day. All you need is 200 twice a week for prophylaxis. They used massive toxic doses. And guess what they found out? When you use massive toxic doses, you get toxic results. The drug doesn't work when you give toxic doses, okay? It's a very safe drug. It concentrates in the lungs, 200 to 700 times higher in the lungs. It's an amazing drug because in the bloodstream, you're not going to get high levels, but you get massive levels in the lungs. So you're going to find yourself, if you're prophylaxed, as soon as the virus gets there, it's going to have a hard time getting through because the hydroxychloroquine blocks it from getting in. And then once it gets in, it won't let the virus, it won't let it actually replicate. It actually bring in zinc, and zinc will mess up the copy machine called the RDRP. So with the combination of drugs, it's incredibly effective in the early disease. By itself, it's incredibly effective as a prophylaxis. So I hope does that answer the question?
Yeah, I want to emphasize on something that Dr. Urza just said because I love the question. This is a treatment regimen that's very simple and it should be in the hands of the American people. The difficult aspect of this is that at the moment, because of politics, it's being blocked from doctors prescribing it and it's being blocked from pharmacists releasing it. They've been empowered to overrule the doctor's opinion. Why is this not over the counter as you can get it in much of the world? In almost all of Latin America, in Iran, in Indonesia, in sub-Saharan Africa. You can just go and buy it yourself. And the dose, my friends, is 200 milligrams twice in a week and zinc daily.